The last time South Africa hosted the AIDS conference in 2000, then President Thabo Mbeki focused on poverty rather than the pandemic as the country's leading killer. Researchers were still presenting papers to refute claims that AIDS drugs were ineffective and dangerously toxic.
His name is Ngozi Johnson.
And 11-year-old Ngozi Johnson was thrust onto the world stage as AIDS activist.
Hi, thank you very much for inviting me here. I'm very happy to be here.
But a lot has changed since then. According to UNAIDS, there were more than 6 million people living with HIV in South Africa by 2012. It also reports that the number of new HIV infections have fallen between 2004 and 2012. While the number of people who take antiretrovirals daily stands at around 2.5 million, South Africa is now leading the fight against the pandemic.
We are going to launch...
Last week, the government announced plans to step up the current treatment and prevention program. From January next year, HIV-positive patients will start receiving free antiretroviral treatment once their CD4 count falls below 500 instead of the current threshold of less than 350. Health Minister Aaron Motsoaledi says they're pushing to turn the tide on HIV/AIDS by 2030, as declared by this year's Melbourne conference. Hosting the AIDS conference in Durban is significant because KwaZulu-Natal is the province with the highest number of people living with HIV. The conference offers researchers, activists and policymakers a chance to assess where we are, evaluate recent scientific developments and lessons learnt, and collectively chart a course forward.
You deserve to know more.
eNCA.com